Up next, we have Dr. Don Pelto, who is the owner of Central Massachusetts Podiatry. Is it Worcester?
I thought it was Worcester to Worcester, but I thought it was Worcester.
Okay, there we go. He has a YouTube channel for his patients and a podcast in YouTube called Podiatry Practice
Mastery.
Oh, well, look how that's
That's funny, huh?
Yeah, where he shares ideas on practice improvement for other business-minded podiatrists.
Thank you.
You're welcome. Thank you.
Thank you, everyone. And so, how many people? This is the executive, right? You guys will manage the clinics, right? Yeah. Okay, good. Has anyone ever heard of something called patient presentations before? Ooh, okay. So, we'll kind of talk about this. Do any of your doctors? Let's talk about plantar fasciitis. What do they use? Currently, they use like a foot model, right? They use a foot model. You might have a little chart on the wall. Anyone else do something different? No. Okay. I'm going to suggest a few things that you might want to consider. Might be a good fit. It's kind of really revolutionized my practice. I'll tell you a little about the backstory of this. I thought this was a great idea back in residency, and then I asked someone about it, and they said, "Oh, that's not a good idea." So then I forgot about it for a number of years. So for any of you that are kind of entrepreneurial, you want to try new things, I would say just don't ask people's opinion and just do it versus asking. So the goal is to use something called patient presentations to improve your patient care. But since we're at a practice management conference, I would say that these presentations alone probably be make me about $10,000 to $20,000 per month more in the office. So like we said, I own this thing called Podiatry Practice Mastery. It's my hobby, and that's what I do for fun. That's what my wife calls it. You know what a hobby is? It's where you spend a lot of time and money on something and you don't make any money, so it's still kind of a hobby. I think eventually it'll pay off. So we're going to go over how to use patient presentations in daily encounters with patients, how to simplify technology, and how to make your own presentations if you want to. And I'm going to go through some of my pitfalls. And this is for you. It's going to help you see more patients, or your providers are going to be able to see more patients, how you can ethically earn more revenue. And this is the key. And offer more comprehensive care. And I specifically like it because it really helps me simplify. I tend to find when you come to a conference like this, for example, we look at all these things to treat plantar fasciitis, you get a little overwhelmed because does anyone feel like sometimes there's too many treatment options? And you don't know which one to talk to your patient about? Do you talk about the night splint? Do you talk about the laser? Do you talk about orthotics? Which one do you talk? How can you talk about everything? It gets a little overwhelming. That's how I was feeling too. So the problem is, I had too many patients and I had too little time. Who feels like that? Whose providers maybe run a little bit behind every day? Because they want to take care of their patients, so they're always running behind. And so these are sometimes complex treatments. I don't know if you've thought about that, but a lot of the treatments we do are very complex, like plantar fasciitis. It's not easy. Achilles tendonitis, metatarsalgia. These things are like that. Wound care. They're kind of complex. And then we're always running behind. And so what ends up happening is you're rushed, you're stressed, you're overwhelmed, you're running behind, and you tend to do this. You explain it according to the time allowed. I don't know if you ever heard about it. Let me give you an example. If you have a new patient, let's say, that's referred from maybe a primary care, and the next patient was canceled, and you're kind of there, you give them the best plantar fasciitis explanation in the world. Have you ever found that? Or if it's an actual doctor there, you're going to spend a lot more time with them. But if you're running an hour behind because your post-surgical patient had a complication and you have a plantar fasciitis patient, you're going to say, I'm going to strap your foot, give you cortisone, and see ya. Does that sound similar to some of the doctors, what they do? They just kind of rush with some and take more time with others, and that's how I was too. So I was feeling a little bit overwhelmed. I was inconsistent with my treatments because I gave treatment according to my time, not according to what they really needed, and I always felt rushed. And then I was a fear of getting sued. So let me tell you what happened. The worst thing that you can think. What's the worst thing that would happen to a doctor? That's what happened to me. Got sued. Yep. So let me tell you the allegation. And then I ended up finding that it was a drug seeker patient and all this other stuff. But anyway, let me just tell you, you have to learn, why did this happen for me? This is what I always think of everything in my life. Why did this happen for me? How can it make me better? And so the allegation was that I didn't do a very comprehensive pre-surgical discussion. They didn't remember it. I don't remember if I did. I think I did it. I don't know if I did it or not. But they signed the consent before surgery. Because I tend to do a pre-surgical discussion 30 days before every surgery where I get surgical consent. In this case, she was a workman's comp patient, or not a workman's comp, but she was like out of work because of something, and she wanted to get back to work fast. So I said, well, I think we have a slot coming up. Let's get you in there. And usually I had my system pre-surgical discussion 30 days before, signed the consents, but she was in a hurry, and I tried to accommodate that. Burnt me in the butt.
Always.
Okay? So let me tell you what happened. Is I got this letter, and I thought to myself, okay, this is key. If I could do it over again, what would I have done differently? I do this for everything in my life. My kid gets upset and something happens at school. I say, if I could do it over again, that makes us take responsibility. We tend to want to push responsibility. It's the patient's fault. They're a drug seeker. No, but how can I find some good out of this? This is a real key concept in my opinion. So if I could do it over again, what would I do differently? And I thought to myself, I was sitting up at night, I said, you know what? When I'm talking about surgery, I'm kind of disorganized. I'm like, this could happen. Talk about blood clot, depending on the surgery, I talk about different things. And I was thinking, if I could do it over again, I would make a PowerPoint presentation. And I was thinking, wow, that's a good idea. So let me show you my first one. This is from 2012. This is my first, I called it patient, I didn't even know what I was doing back in the day. Patient presentation. Your surgery, before, during, and after. This is what it was. 7 slides. I went over before surgery, during surgery, after surgery, most common questions. It's a pretty horrible slide deck if I do say so myself. Then what I started to find out is I'm like, so a lot of our growth happens when sucky stuff happens to us. And then I was thinking to myself, what's the part of the day that I really like the most? I'm like, I really like these pre-surgical discussions now. Like, this is pretty cool. So then I thought to myself, well, and I was doing this coaching thing with a coach, and they always talk about what's working and why, and then what's next. Like, how can I do more of what's already working? And then I thought, well, if it's working for that, what's the other sucky thing that I treat? What's really complex? I thought of plantar fasciitis. I really don't like plantar fasciitis because it was kind of real complex. I like treating it because of the money, but it's really complex and convoluted. And I thought, well, what happens if I could just make another slide deck on plantar fasciitis? And then if you do one, you have to do 20, right? So then I had porokeratoma, then Achilles tendonitis, then metatarsalgia, and most of them sucked, okay? And I was doing them on Google Slides. I was figuring, how am I going to do this? What are the patients going to say? My first slide deck was 20 slides long. It took me 45 minutes. Now they reach 5 slides, okay? So learn from me. Don't make super huge slide decks. The benefit to the super huge slide deck is you make a YouTube video about the whole 20 slide deck, but the one you show them in the treatment room is the 5 slide deck. Okay, so if you use mine, and I'm going to give you access, you guys can use all mine for free. The problem is I might treat a little bit different than yours, but you can use all of mine free, and I'll give you all my hacks. So I'll teach you how to do it first. You open up Google Slides. Who's heard of Google Slides? It's free, easy. Okay, you have to have a computer, and you have to have some type of a device. Could be iPad. It could be, and I'm going to give you all the slides with the QR code later on with this. A way to look. We happen to have computers in every treatment room, okay? And I have a virtual scribe in my pocket, so my scribe does not need to use the computer. So that's one benefit. But I have other doctors. They sit next to the patient and they do it. Important slides. If you're going to do 4 slides, you want to do a title slide, an anatomy slide, an imaging slide, and this is my money slide. It's called Treatment Evaluator Slide. Doesn't sound cool. When did I used to make it? Well, I had a little downtime between patients, and I'm kind of this way. I like to be efficient, so I was like, I didn't do anything at home. I just kind of, I got some time, let's do another one. And then once a good one happened, then I copied and pasted it, and I did it that way. And then you modify it based on patient questions. So I started to do them, and the patients asked me a question. When they asked me a question, I added a new slide, and that's how they got 30 slides long. So in the beginning, I used to add new slides based on the questions, and it's really neat because the benefit of these is you answer objections before they come up. right? So you want to answer patients' questions before they ask them. That's what helped with the slides. So let's talk. I was going to try to do this online, but the internet is very bad. This is what I call, and what I give out to everyone. You can use mine. I use it every single day, multiple times. It's called a patient presentation tool. You can get it at patientpresentations.com. It's totally free. It took me more hours than you can imagine to make. Let me explain the background. So if you click this slide, it's going to pull up a Google slide, but the key is it's going to be in full screen mode. There's 2 different ways of doing Google Slides. You can do it present mode, where you it's called it's techie, but it's publishing to the internet. You publish it to the internet in full screen mode. Why is that? Well, it's because it's one less click for me, and also you can all use these. You just can't copy them. You can't download them. Okay, if you want to download them, you have to, you can talk to me. We can talk about that later. But you can use mine for free. I would love it if you use them. I would be honored, and I'd like feedback, please, because when you're a creator, you created this in a bubble. So let me share out this is what I do. I'm going to actually do the presentation for you. Hey, Mrs. Jones. So patients come in. I've treated them. You have pain in the plantar medial heel. You have a little bit of Aquinas. You do a little walking. I look at your X-rays. Okay, Mrs. Jones. Actual wording. Mrs. Jones, I like to use pictures because it helps me to understand a little bit better. Do you mind if I show you some pictures? Oh, that's fine. I go to the Google. I save this on every desktop. It's a little one link. I open it up. It pops up patient presentations, and I pick which presentation. And I said, Mrs. Jones, don't worry about taking notes because I'm going to send you a copy afterwards. So I send them a copy of me doing this presentation, the long form, with me like a bubblehead talking. And what's that doing? Reinforcing. And it's also pre-selling like shockwave, amnio, AFOs, stuff like that in the long form content. So this is short form, 5 slides. Slide number 1. And Mrs. Jones, you can see your pain is hurting right there. That's where it is 99.9% of the time, either plantar medial or plantar central. So I include in here the questions that you want to get to their pain. And these are the same questions pretty much for all my slides. How long have you had symptoms? Now, I've usually asked them this before, but I just reinforce it. So you said you've had pain for about 2 years, right? Okay. And you've tried icing, anti-inflammatories. You've seen 3 other podiatrists. Okay. And usually when I do these, like they say, no doctor has ever been so prepared in my life. And I did the preparation before. Okay. And I said, Mr. Jones, how does it impact your life? Why? Because you want them to explain the pain. And you say, and then what they do is, how does it impact your life? It hurts getting out of bed. Then what do you say? Tell me more. I can't run. Tell me more. I can't play with my kids. Tell me more. The key word is tell me more. And after you say like 3 or 4 times, they're like bawling, and they're like, okay, that's where you find their pain. And then you say, why do you want treatment now? Because if it's not hurting them, they don't want treatment, so it's not even worth it to do anything. But you want to develop that pain. There's a technique within marketing. I kind of like marketing. It's where you have a wound. You put salt in the wound, you rub it around, and then you give them the solution for the wound. Okay, that's what this is. It's kind of producing that. This is slide number 1, 2, 3, 4. Okay, there's only one. There's 2 more after. What is this? So the way I explain it, I say, Mrs. Jones, you have pain here on the bottom of the heel. Do you see this thing? This little white thing right here is called fascia. It's about as thick as a piece of bacon. What color is that? White. What do you think? Do you think white things have good blood supply? No, probably not. That's a lot of times why people with plantar fasciitis, Achilles tendonitis, posterior tibial tendon, any of them, they don't really heal that well. And many times, instead of getting healed, they get thicker. Okay? And then I also say, and you can see the fascia kind of connects with this, but most of my problem comes from the back of the calf, because everyone has something called Aquinas, which is just tight calves. Pretty much everyone does. And I kind of explain the importance. And so if you wanted to loosen something up, where is it going to be easier to loosen? On something that's white or something that's red? Well, probably the red thing. So that's how all of my patients get a foam roller. That's how all of my patients get a night splint. Okay, that's the way. And remember we had that talk before, you don't want to sell anything that's on Amazon? Okay. Everyone's talked to them about stretching. How many people have talked to them about foam rolling? No one. This guy might know what he's talking about. Can they stretch? Yeah, they can stretch. But I think foam rolling is superior to stretching, in my opinion. Okay, so that's why I use the anatomy slide. Those are my exact words. And this is the same slide for Achilles. I would just put Achilles tendonitis. Okay? This is my money slide. This is why every single patient at the follow-up gets an ultrasound with me. Okay? If you have a struggle doing ultrasound, I have no struggle, and insurance doesn't cover it in Massachusetts. So everyone pays me $100, except Medicare. Medicare covers it. But everyone pays me $100. A couple of things I say about ultrasound. We'll talk about the money later. We'll talk first about this. Mrs. Jones, do you see here in this little ultrasound probe? Yeah, that's an ultrasound. So when you look at your heel, we don't always look at the spur, and I remind them about that x-ray. You had a spur. The spur isn't the problem. But the real problem, remember what I told you about that fascia thing, that it sometimes can get thicker? Yeah, I remember that. Well, here, if you look, this tissue looks similar to the tissue around it. See that? Yeah. So this is normal. You see how this tissue, how does this look different? Oh, it's a little thicker, it's a little blacker. Yeah. I don't say that's an effusion. I say there's some swelling in there. And what happens if something doesn't get better, it gets thicker, kind of like scarring. Because when something doesn't heal, it gets a scar. That's how I explain it. Okay, it's thicker. So, we're going to start some treatments today. And when I see you back in a couple of weeks, if it's not better, we're going to set you up for an ultrasound. That's how everyone, and then I my scribe puts something next visit, ultrasound. Make sense? This is my money slide. And I have a money slide for everyone. Now, this has been multiple renditions. This is, I keep simplifying it more and more. Okay. I used to go over and show them a picture of an orthotic, of shockwave, of cortisone injection, of a walking boot. I used to show them all the pictures. It took me forever. So now what I do is I say, and then when they come back the second time, or the third time, or the fifth time, or the 10th time, this is the only slide I show them. Why? Because many times we get stuck and we're very subjective, and we have to be more objective. We have to pull ourselves away as a doctor and say, well, I'm having a problem here. They're not getting better. Okay, this has 99.9% of the time, besides surgery, what I can do to help them. And so let's say they're back for the 5th time. Okay, we've done shockwave, we've done cortisone. Oh, we haven't, what's this AFO thing? And that's where I'm going to do the AFO, the Aero Spring AFO. Or they've tried everything except orthotics. Oh, I haven't tried orthotics. This is how they're asking me. Oh, I haven't tried a walking boot. They're asking me to do a walking boot. I'm forgetting about it most of the time because I don't do many walking boots, but they're remembering it because they're looking at this. So the way I use this is I say, Mrs. Jones, there are some treatments that are most effective, others that are least effective. They're not all created equal. Oh, yeah. And there are certain treatments that help reduce the pain, others that reduce the tightness, and others that reduce the stress through your foot. Okay, I keep it real simple, 3 categories. This is how you don't overwhelm them. Most of my patients try the things underneath the red line before they come in. Oh, yeah, I've tried these. What have you tried? Oh, I've tried anti-inflammatories, I've tried icing. Yeah, I tried that CBD stuff, didn't work. That's why, because it's not that effective. I've tried stretching. Yeah, it's not that effective. I've tried over-the-counter arch supports, taping, and that's how I do it. And then what I say, and I pull out my, if you guys want one of these, you can pull it out. This is you can pass these around if you want, or you can get them after. Just take one and pass it around. I pull this out of my pocket. And I say, what we're going to do, and I put their name on here. What's your pain level again? I put it on here, and I say, okay, we're going to start with the basics today. So remember, you've heard about the patient protocols, okay? So my protocol is, we're going to start with giving you like an anti-inflammatory, because have you really tried it consistently for 2 weeks? No, I haven't. Well, let me give you a Celebrex. Part of the reason for prescribing is you can up the level of the visit to a level 4 patient visit, okay? Have you tried icing? Yes. Have you tried contrast baths? No, what's that? Okay, take 2 buckets of water, bucket of ice water, bucket of hot water, you go back and forth, 5 minutes, 5 minutes, 5 minutes. Okay, you're going to start with that. This is the key. At the follow-up, we're going to do the ultrasound, and the ultrasound is going to help me determine if we're going to do cortisone or shockwave, because it is the ultrasound that determines that for me. I don't do it based on palpation. I do it objectively based on the ultrasound. If there's thickness, if there's blackness, if there's effusion, then I do the shockwave. Second category, I say, Mrs. Jones, you've been stretching, hasn't really worked, so we're going to, I don't tell them this, but I say, we're going to do the Pelto special. And I go out, and every patient gets the Pelto special. It used to be called the Saviet special, because my partner started to say it, and I just give it my name. What's the Pelto special? It is foam rolling, a night splint, and a morning stretch ritual. And it's all right on here. And I just check the box. I click method, foam rolling, I write it out, I check the night splint, I check the towel stretch. And then what I do for the stuff, and I'll show you this later, the stuff I'm going to do next time, I circle it. Okay? And then the following thing, I talk about reducing the stress, and I'm usually doing a gait evaluation before all of this happens. And I'm, what I usually start with this is I have them get an OOFOS, which is a home sandal. I make sure that they're in appropriate shoes, or I send them to a shoe store. And then I say, based on the way that you're walking, you have that pronation or things like that. And so I would recommend you getting an orthotic. Okay? And I always start with the orthotic. Okay? Most people have tried changing shoes over the counter, things like that, so I'm going to recommend an orthotic for them. That's how I do that. Some say yes, some say no. In Massachusetts, orthotics are never covered by insurance, so everyone's paying $600. So a little bit more challenging for me, but I offer it to everyone. This makes you offer it. If it's not here, you're going to forget it because it's uncomfortable. Okay? It's uncomfortable to talk about money, what's not covered. I'm uncomfortable with it, but I have a process. Okay? So that's what they're going to do, and I check it on the other side, supportive shoes, custom orthotic, OOFOS, and I share where they can get the OOFOS. And I say, any questions? No, my assistants are going to follow up with you. Okay? Second time they come in, I go over, and I also say, there's something called Patient Education Genius. I check that because I send them. You say, Mrs. Jones, I'm going to send you a copy of this. I'm going to give you my new patient welcome packet. I'm going to send you this. Let me give you the error that I made in the past. So there's this thing called Patient Education Genius. And I guess if there's some is good, a lot is better, I thought. So I used to send them a video of foam rolling, I used to send them 30 things. Okay, so now all I do with Patient Education, I send them one web page that has everything. And it's a replay. It's a written replay of exactly this, of what you would call the patient protocols. And then it is also a video of the same thing, but in extended form of Don talking. Make sense? And I say, Mrs. Jones, I have you. If you think you could watch a video before you come back, yes. Okay, please watch this video I'm sending. It's very important. So when they come back, they're positioned. We call that positioning. Okay? Even better yet, this same page, the same link is on our website. And before they come in, if they could even watch that before, they're already on second base. This is how I use this every single day. This makes me at least $1,000 more per week or per day, because it's 2 orthotics, right? So it makes me so much money. And the second time, I go to the next step and next step. Okay? So let me just show you. So you can see here there are these links. See those underlined things? So if you use my slides, what you're going to find is after this slide, it's going to be black. That's black for me to know I'm done. That doesn't mean it's done. Then you got another 30 slides down there with the long version that you can record on YouTube if you want to do your own thing. Then you're going to have the main questions. You're going to have everything really in detail, really in depth, but I don't have time to do it. But they're hyperlinked to the slides. So let me show you those slides. So this isn't for the first visit. This would be second, third, fourth, fifth visit. I'm going to go over shockwave. It has a shockwave slide. They don't know what any of this stuff means. The only thing that they know is there's growth factors in stem cells. That's all I focus on. So I have radial and focused shockwave. Orthotic, I show them what an orthotic is. I also have them to show on their foot. Aero spring AFO, which is a way to offload Achilles and plantar fascia. I do not use that on everyone. I'm just saying, but this is something that's an option for them. And then this is the amnio injection slide that I have. I do not do amnio on everyone. I want to be clear, but some patients I do amnio. Okay. So how do you use that tool that I gave you? You open the link and you show it to the patient. It's all set. The only problem is if you treat it differently than I do, then you'd have to make your own. Okay? And that's fine. You can make your own. If you want my slides, just send me an email. I'll teach you how you can get those. It's just a pain in the, to make, because I have them on everything. It's a pain. So what are the benefits? I love this, and my scribe are the two things that I love the most. Why? Because with the scribe, they do everything, and I just treat the patient. And then with this, I don't have to think. I just present all day long to my patients. And I have everything that I do in the presentation, so I don't have to think. And I never get rushed, and I never forget anything, and I never avoid saying anything because it's not comfortable. Everyone's getting the exact same presentation every single day. So I'm kind of animated about this. I kind of like this stuff. So more enjoy treatment simplified, complex, objective versus subjective, treatment evaluator is my salvation slide when things aren't going well. You can train your new doctors. This is how we do things. We use this presentation here. It gives you more confidence. It's more what we call comprehensive care, right? I don't know, that's how I do it. So questions. So a few questions. These are my questions in the beginning. Do I have time? The first doctor that I told about this however many years ago, before 2012, he said, Don, there's no way you're going to have time for this. And I just believed him. It takes me 2 to 3 minutes. I'm actually quicker because I just show the pictures. You know how long it is to explain? You got that band on the bottom of your foot and this, it's just a lot harder. It won't work for my practice. I would propose just trying it. Now the key, try it on one diagnosis first. I got 20 diagnoses, okay? Try it on plantar fasciitis. Then if you like that, do it for everyone. Tell me, give me 10% of what you make more. Just send a little check to me, okay? Tell me if it doesn't produce. Tell me if it sucks. Tell me why it doesn't work. I want to help you. Like, I'll coach you through, okay? Just try it. And don't try it with the patient the first time. Like, try it first with the staff, okay? What if I don't have a computer? Because you have to put it like it's a link, so it's online. So you could take an iPad and do the same thing, put the link in the iPad. Some doctors, what they do is they only like the money slide. So they print it out and they just use that as that one. It's just a colored slide. They just like that one. How do I make these? I think I told you. Google Slides, you can make your own. What if I don't want to make my own? You can let me know. I can help you. So this is the foot treatment checklist thing that I do. Few cool things about this. It has a texting phone number on it, so I don't get emails. I don't get my email out anymore. It has office. It has when their appointment is. So on this, this is mostly for musculoskeletal. Okay. Name, diagnosis, date. I fill this in. X-ray. I circle the ultrasound, things like that. So this is how it would look after visit number 1. I circle the ultrasound. I circle the shockwave because they know what they're going to do next time. I put checks everywhere else. And I put any little notes that I want right here. The only thing I would improve on this is I would put maybe a QR code to give us a review. Yeah. that was the idea before. But I have that embedded because patient education asks for a review and my medical record asks for a review. If you want access to them, you just go to patientpresentations.com. That's how you get access to my tool and training on how to do that and things like that. So patientpresentations.com. This is the link that it will give you access, and I give you some training on how to do it. So in conclusion, this is something I learned from Dan Sullivan. It talks about the 4 C's: commitment, courage, capability, and confidence. So before you're going to have confidence in doing these and develop the capabilities, you're going to have a commitment. So you're going to try, download the darn thing, figure out you're going to do one. As you practice it on patient, you're going to develop more courage, you're going to get better, you're going to get more capabilities, you're going to get more confidence. And then I'm kind of dorky about these things. So once again, surgery presentation led me to do all these presentations. Then I thought, well, I really like doing these. How can I make it even better? Then what I did is I started to take the same presentations and I recorded videos. Then I said, well, heck, if that's good, I'm going to invite my patients to a monthly webinar. I'm going to use the same presentation. Then I can take these presentations, put them into a blog. I can take these presentations. They're the images for my book. You can take these presentations, put them in social media, and you can take these presentations when you're teaching medical assistants, associates, and others, doctors. You use the same it's cool. It's like repurposing. So you can get the presentation tool there. And what questions? Was that helpful? Hope that was helpful. Everyone's like overwhelmed.
So Don, since this is mostly executive manager track, we talked about this earlier, and I'm coming in to see this in particular. Are there any other docs in the room? Okay, right. Hey, so we all are like, this is cool. For the executive managers, are you worried at all about getting your doctor to commit to this? Nobody? Cool. That's my question.
For the doctors that are here, because when you're a creator of ideas or content, it's very lonely. I don't get any feedback, so just email me. I would love it if...
I'm going to make a treatment off of my Tulsalin video.
I'm going to do Tulsalin's going to be added to my nail fungus presentation.
Steve will have, I want to see your presentation.
Yeah, well, you go to the fungus presentation, and just, Tulsalin will be in there soon.
Okay.
And so if you just
but
scroll
are
down.
you using my
I'm going to just...
Am I inspiring?
Yes, you are.
Okay, good, because you inspire me too, Don.
So just the same one.
Oh, it is.
It's the same
I'm
one.
so sorry. I thought it.
It's the same one. No.
But I'm anxious to see your presentation
I'm
inspired.
just gonna add a slide of toastling. That's the only thing I'm
No,
gonna do.
you're not.
Yeah, I am. Because you don't have much time. I'm gonna add that checklist. I'm gonna just add toastal in there. So it's the YouTube down there on the bottom. So you just it's clickable. Thank you. Dismiss this. Go up here. Okay, YouTube. So now we're gonna go to YouTube.